Hi everyone, welcome back to my YouTube channel. Today we are going to talk about salivary gland aplasia. Aplasia means absence of development or agenesis. So, a salivary gland aplasia is absence or agenesis of salivary glands. Talking further, salivary gland is aplasia is rare developmental anomaly that can affect one or more of the major salivary gland. The first thing, it is rare anomaly. The second thing, it is developmental anomaly, and the third thing, it can affect one or more of the major salivary gland. Most of the time, glands affected are parotid gland and submandibular gland. Sublingual gland is usually not affected by this condition. So the other thing is that the condition may occur alone, although agenesis of the gland is often accompanied of one of the several syndromes. These syndromes may include mandibulofacial dystosis, that is also called as Treacher-Collins syndrome. The second syndrome is hemifacial macrosomia. The third syndrome is lacrimo-auriculo-dentodigital syndrome. These three syndromes are mostly associated with salivary gland aplasia, or salivary gland aplasia is component of these three syndromes most often. Whenever these syndromes are present, there is a possibility that the salivary gland aplasia will also be present. So this is how the relation works. Then talking about incidence and prevalence of salivary gland aplasia, salivary gland aplasia has been reported more frequently in males than females, and that ratio is 2:1 of males and females. Some individuals are affected by agenesis of all four of the largest glands, like both parotid glands and both submandibular gland, but other may be missing only one or three of or two of the major salivary glands. There is possibility that only one parotid gland is missing, or two parotid gland, or two parotid submandibular, or the combination of these glands may be possibly missing, but most often they are affected by agenesis of all of the four largest glands. Talking about the clinical features of salivary gland aplasia, in spite of absence of the gland, the face still has a normal appearance. Why it has normal appearance? Because sides of the glands are filled by fat or connective tissue. Intraorally, if we see, the oral orifices of the missing glands will be absent. Some patients may exhibit absence of lacrimal gland or lacrimal puncture because of close association of their genes with the salivary gland genes. Talking further about the clinical features, the most significant symptom associated with salivary gland aplasia is severe xerostomia, because salivary gland function is to produce saliva. So whenever the salivary glands are missing or there is salivary gland aplasia, there is a severe xerostomia and its attendant problems. Xerostomia have different attendant problems. That are, the tongue may appear leathery and the patient is at a greater risk of developing dental caries and erosions. These are the attendant problems of xerostomia that occur whenever their salivary flow is less or there is less saliva production. These things occur with xerostomia and there is attendant problems. However, is some degree of moisture that may be present because of continued activity of the minor salivary glands. So it is not like the mouth is completely dry, because there are minor salivary glands in the mouth that may work, and there is possibility that their work increase, but still not they cannot complete the demand, because their minor salivary gland and major salivary gland are also really necessary for the saliva production. But there may be some degree of moisture in the patient because of continuous minor salivary gland activity. Further, if we talk about radiographic features, because of symptoms, if we see only symptom, we can associate many conditions that can cause salivary gland dysfunction or salivary gland hyperfunction. To confirm that there is salivary gland aplasia, we do some radiographic attentions or radiographic diagnosis. The radiographic features include absence of the gland, and the radiography of the gland for gland confirmation can be done by technetium 99M by technetium CT scan. Then we can do computed tomography, and then we can do ultrasonography. These three are ways from which we can confirm the absence of these glands. Then if we talk about treatment and prognosis, so patient management in salivary gland aplasia is directed toward compensation for saliva deficiency, and saliva substitute are thus given to compensate for saliva deficiency. But if there is any residual functional salivary gland is present, then silolog medication such as pilocarpine or cevimeline may be used to increase saliva production. Talking about treatment and prognosis further, salivary flow can also be stimulated by the use of drugs, but it can also be stimulated by use of sugarless gum or sour candy. And with these all things of saliva production or saliva deficiency management, there is requirement for regular preventive dental care because it is important to avoid xerostomia related caries and enamel breakdown, because we know whenever there is xerostomia there is lot of caries, xerostomia related caries more specifically, and enamel breakdown is more easy. So to prevent that, regular preventive dental care is really important. So this was all about salivary gland aplasia. If you like our video, don't forget to like, share, subscribe and comment. Thank you for watching.